Diogenes Syndrome, cause. How does it start? A complex behavioral disorder, Diogenes Syndrome is characterized by a tendency to hoard, neglect of one's hygiene and social isolation. What is the cause? Is it hereditary? What early signs? How to help a person affected? Diogenes Syndrome is a behavioral disorder that manifests itself in particular by negligence in terms of personal and domestic hygiene and social isolation. In question, often a trauma experienced in childhood. The care of a person with Diogenes Syndrome must be plural, social, medical and psychological. What is Diogenes Syndrome? What are the causes? Is it hereditary? How to help a person with Diogenes Syndrome. Definition: what is Diogenes Syndrome? First described in 1975 by a geriatrician from the city of Brighton in England, Dr. Clark. Diogenes Syndrome is a complex behavioral disorder that often leads people to neglect their personal and domestic hygiene as well as their isolate. Famous Diogenes include, for example, film producer and director Howard Hughes and sculptor Camille Claudel. Is it a disease? It must be understood that Diogenes Syndrome is not a pathology but a set of symptoms behind which there may or may not be an associated disease. What are the causes of Diogenes Syndrome? Diogenes Syndrome is likely due to trauma experienced in early childhood. After a long interval of life, without particularities, the process of diogenization can start on the occasion of a separation, a death or an abrupt change of situation. Like the philosopher Diogenes of Sinope, from whom the syndrome borrows the name, the Diogenes are people who were born in paradise and who slowly or brutally go to hell, confirms the psychogeriatrician. It is this rupture of life that will completely disrupt their relationship to themselves and to others. This way of life is the visible part of an ancient invisible process which caused the harmony of links with objects, the body and others to be lost. And to add, I remind you that Diogenes of Sinope was born in a rich and loving home. But, very quickly, the father, a banker accused of making counterfeit money and risking a death sentence, flees in a boat with his family. The boat is captured by pirates and the young Diogenes sold as a slave. Is Diogenes Syndrome hereditary? No, Diogenes Syndrome is not at all hereditary. It is a pathology linked to a given moment, to a person's life course, replies Dr. Beatrice Maletra, Doctor of Psychology. How does Diogenes Syndrome start? In general, it starts with the idea that each object is important and could be useful to you, which is not completely false in absolute terms, indicates Dr. Beatrice Maletra, except that afterwards, this idea will expand until the individual thinks that everything can be of interest. He will even keep the old newspapers that he has not even read. There is this idea of wanting to save everything for later. It becomes a spiral infernal, develops the psychologist. What are the symptoms of Diogenes Syndrome? Several symptoms, sometimes very opposite, are suggestive of Diogenes Syndrome: accumulation of objects, negligence of personal and domestic hygiene, social isolation, asceticism and self-care. In psychoanalysis, two opposite symptoms can be signposts to one and the same difficulty, recalls Dr. Montfort. Harmonious with objects. Either people will be extremely attached to them and tend to accumulate them, or on the contrary, they will turn away from them and live in the most extreme destitution. In the same way, certain Diogenes will have a very neglected when others will take great care of them. That is why it is a difficult disorder to spot. What are the profiles at risk of being affected by Diogenes Syndrome? Half the time, people with Diogenes Syndrome have an associated disease. It may be an Alzheimer's syndrome in cases of neurodegenerative pathologies, or a schizophrenic, obsessive or phobic syndrome in psychiatric pathologies, specifies the psychogeriatrician. But the associated pathologies, when they exist, are not risk factors for Diogenes Syndrome. According to the concept of the exposome, all of the exposures to which an individual is subjected from conception to death, it is probable that very early on, in early childhood, a traumatic cause could be a risk factor, both for Diogenes Syndrome and of an associated disease.